Dr. Yiola Marcou is a consultant medical oncologist at the Bank of Cyprus Oncology Center. She completed her medical studies at the National and Kapodistrian University of Athens in Greece, and her internal medicine and oncology training in the UK. She was accredited as a consultant clinical oncologist at the Charing Cross Hospital in 2003. Today, she serves as the head of the breast multidisciplinary team at the Bank of Cyprus Oncology Center and as a professor at the Medical School of the University of Nicosia. She is also a member of the National Cancer Committee and the National Breast Cancer Committee, the latter of which she previously served as the president of the Cyprus Oncological Society. Throughout her practice, she ran various initiatives with local NGOs to raise education and awareness around breast cancer topics. She has additionally been the recipient of multiple prizes for her oncology work. Dr. Yiola Marcou, welcome to the Future Makers podcast.
Thank you so much. Thank you for the invitation.
Of course. I want to start from the beginning, and I always start with this question. It's a quote from one of my favorite philosophical thinkers. Kierkegaard says, "We live life forwards." Am I butchering it? Yes, probably. We understand life backwards, but we live it forwards. How does that apply to you, and especially looking at your early life?
Okay, my early life, I was born in Cyprus, if you want me to go that back. I was raised in Paralimni, member of a big family. So we had lovely summers in Protaras, my favorite place. And then I studied, I've done my medical degree in Athens. So I had very nice 6 years in Athens, and then I went to England for my training, postgraduate training. So I've done my medicine there and then specialized in oncology. I had a great time in England, very hard work because we had lots of exams and on the professional bodies. And then in 2003, I returned back to Cyprus and I started working at the Oncology Center. And indeed, you always look forward and you always make plans for the future and you work hard as a professional to achieve whatever targets you had. And I will go through the targets. But you don't have the wisdom of the life experiences you got throughout your career. So throughout medicine and throughout oncology, especially oncology, you learn a lot. You learn a lot about people, about balances, about ethics, about dilemmas, about love, about commitment, fight for life, fear for death, and all these experiences come with years. So I dare to say that now, having worked many, many years in oncology, I am more experienced as an oncologist. I think, have the passion of my work and what I do. And I do hope that with all these experiences, I can help even more the people of this country, of this small island.
Thank you. I want to talk about the environment and the family and the social circle you were growing up in. Was the plan to go into medicine always there? And was the environment kind of promoting or encouraging that dream?
No, I wouldn't say that. Annetta, it's different for us. I think our children have more challenges. They have probably, though, better view of what a profession is. So in my ages, if you were a good student at your school, you had to do few things. You had to become a doctor. Very good students at that stage wanted to become doctors, some of them engineers, some of them teachers, because I was at the time when very good students from the schools became teachers in this island. So it was like a one-way road. I was a very good student. and I thought I would do medicine. Did I know what medicine was at the time? No, because none from my family was a doctor. So I didn't have a clue what medicine was. It was just, you're a good student, you do medicine. Actually, my dad, who died recently, few years ago, told me, no, you shouldn't do medicine. You should go into business, because I was a very active person. Because with medicine, you wouldn't earn lots of money, and I mean, it's and so I started medicine, irrespective of the family background that nobody was a doctor. When you start medicine, the first years, especially when the way we were trained at that ages, so it was completely different. It was very, you do physics, chemistry, that has nothing to do with medicine. So at the university, we had some difficulties. Athens University is a very competitive place to be. And gradually, you start realizing what medicine is. Have I regretted? Never. Even if I have to go back again, and despite the difficulties doctors have in this country now, because we are living through challenges with a new health system, with many difficulties in our life, with many difficulties with the pathway of patients, doctors and things like that, I would still go back and do medicine and do oncology and treat women with breast cancer. Because for me, it is very fulfilling what I do. It is a difficult job, and the message I have for any young people that listen to me and they want to do medicine, you shouldn't do medicine to become wealthy. If you want to become wealthy, go and do something else. Go and do engineering, go and do AI, go and do stock market. Medicine shouldn't be about money. Medicine should be about challenges, science. This is a job where you have the new, the innovation, all the science is there, caring for people, being committed to what you do. And this is what medicine is all about. Care, science, knowledge, ethos. This is what young people should do.
I wanted to ask, how when you attended the university, was medicine a very popular choice for women?
It wasn't unpopular. I think it was more popular compared to what it was 50 years ago, because at that stage, many males were doctors. When I went, yes, still in my year, we had more males compared to females, but women started choosing medicine. So if we see what is happening with the choices people have with sexes, it's surgical specialties, there are fewer women, but in medical specialties like my profession, I'm a medical oncologist, there are lots of women today. Things are changing, and now in the medical schools there are more females than males, because probably women are very bright and they do very well on their studies and they're very hardworking. So we have many women today choosing medicine.
It's very encouraging to hear, especially since there has been a push to get more women into like STEM subjects.
Yes, absolutely. Okay, engineering, I think the scientific subjects, I think they are still more male dominance. But in medicine, we have more women practicing medicine compared to men.
And just to finish kind of the topic of your early years, I wanted to know, who were like the female mentors? Who were the women you were looking up to and who were raising you during those, up to the time you were, even during your university years? Who were you looking up to?
I don't think, I think people should look up to the nice people around them. And I will tell you the challenges you have as a female, but for my life, both my parents were my role models. I mean, my mom was a very hardworking person. Don't forget that I was born just before the Turkish invasion. So we were living on the coastal line in Paralimni. And my family, my grandmother was from Famagusta. So we lived through the separation of the island. And our parents had to work very hard to build up again their lives and for us to study and to go to universities and to provide everything for their children. And that was the society of the Greek Cypriots 40, 50 years ago. They were doing everything for their children. So my mom used to work very hard, very committed to what she did for us to have everything in the house. You know, my mom always cooked the nicest food, all, healthy and nice. But and I think she's my role model in the sense of how hard one can work to be, strong towards their children. My dad, on the other hand, was a very cheerful person, a very positive mind. My dad, we set up targets and we will do it. So I don't think I had my parents. I was very lucky to be raised in a house where we had stability, we had fun, we had nice times, and with parents that spent long hours with us. So all our weekends, and this is what is the sad thing about nowadays and our kids, is that I remember that the whole Sunday was for us. The whole Saturday, when they finished work, was for us. We used to go to the beach. We used to cook. My mom used to cook. We had the whole family around. I mean, they are wonderful memories. I mean, I feel bad because sometimes my work took me away from my two children. But although I tried to, all my free time was for them, I think we are living in a more competitive society. And for the children, it's not as easy as it was when I was raised.
Do you think that's something that we should be putting more effort to be conscious of and try to change it, especially for working parents?
Yes, absolutely.
Do you think there is a danger?
Absolutely. I think what it's good to see is that our parents' generation, they work hard on a small society, the Cypriot society, because they were the generation that went through the war and the Turkish invasion. For us, we continue to work hard and to be an achiever in what you do. Sometimes you sacrifice many things. The younger people, I think they have more balances. And I'm very happy to see my younger colleagues at work that they will, I remember myself working many hours. So even if I work in an almost public hospital, I'm not a private doctor, so we finish work at 4, but many days I will stay behind until 8, 9, do work or go home, see the notes, take all the blood tests of the patients to check them. And it's a way, because for me, the breast cancer practice is something we built it. I came in a center, the oncology center was very organized. The breast practice, though, we shared with a colleague, and we devoted many hours of our lives to write down protocols. You don't find these things. We are a very small country. It's not like you are in England and the NHS has through, the paperwork, the protocols, this and that and the other, and everything is streamlined. Here, we made it. It's like the oncology center for the older oncologists there. It's like our baby. We built at the center. And we put, not only me, all of the team of the doctors, we put major effort for the people of this island to have good oncology practice. The younger colleagues, I think they are more balanced. They will say, okay, some of them might choose to do a part-time work. Great, because you need time with your family and you need time with your children, because children is a big commitment. And the kids today, they're raised in a very challenging societies, and they have lots of insecurities, lots of, the drugs, the alcohol, the spitting, all these things. And you need to be near, and you need to be there, and you need to be with them. So I do hope, and this is the thing, that women are more responsible in Cyprus for raising up families. Although, again, this is changing, and I'm not against males. No, I think both parents should be there, and I mean that. But women have this responsibility and to be very successful in what you do and to balance your family, your children, to overlook them for their tests at school, to take them to a small party, to organize their party. It's very difficult for women to balance how you balance your personal life with your successful work life.
Yeah. I don't like the word for compromising. I think a lot of women, in professional sectors would say, oh yeah, if I take care of the children, I'm compromising my professional success. What word do you think would better
I agree with you. I don't like it. And I don't think we compromise. I think women are more balanced because they do everything. And I believe that, we might not do, if I go back on my work, yes, I might not have traveled as much. I might not have participated in many European projects as I could have done with my background. Because, I didn't want to be away from the children. I wanted to be around. I chose to go to the 2-3 big conferences yearly and not too many. I mean, I'm sure lots of male colleagues might have done a different option because they, their wives might have been working less hours and this and that. So, and I agree, you don't compromise. I didn't compromise. It was my choice. I hope I did okay in both sectors, my personal life and my work life. And I think that's why women are more balanced, because they choose both. And it doesn't mean that, okay, if you are not the executive and this and that, you are not successful. You are successful as long as you do something that you like, and you through your work you have this fulfillment, especially in our work, of giving and supporting and being there. It's not a compromise to have hours for your family.
Let's go back to 2003. You returned to Cyprus. You joined the Bank of Cyprus Oncological Center. What was the space of oncology in Cyprus in that day? Was there another center? Where was healthcare at that point?
Okay. In 2003, when I came, Oncology Center was already there, and it was a center of 5 years old. So it was a new center, and it was the only center with radiotherapy facilities. So it was the only comprehensive cancer hospital, in the sense that we had medical oncology and radiation oncology. And actually we had at that stage, I think, 2 or 3 linear accelerators up to date, because the Bank of Cyprus gave this investment, and we had all the new equipment. In Cyprus, there was the Nicosia General Hospital and the Limassol, with very small, though, oncological practices. So the center was starting to pick up. And it was the Oncology Center works in it's not a public hospital, it's not a private hospital, it's a non-for-profit foundation. So it was something completely different from the rest of the hospitals of the island. And the standards of oncology, actually, when I came, they were very high. And I came from a big central London hospital, and you come to Cyprus and you think, okay, we might not have this and that, but we did. We had access to new drugs, we had innovative drugs. When I came, Dr. Adamos, who was later MP and Euro MP, he was a fantastic guy. He was doing the medical oncology for breast cancer at that stage, and patients loved him. And I came, and I was very young, and Adamos left because he became a politician. And I stayed there with thousands of women. Some of them at the beginning were not trusting me because I was very young, and they thought, oh my God, does she know what she's doing? But gradually, I think the first 6 months, people realized that I was good as their previous doctor and caring as their previous doctor. And then another colleague came, Dr. Kakuri, and Dr. Papamichael, who was the head of the department, very supportive. And we started to build up a real breast cancer practice. We've done collaboration with the surgeons, and they had some fantastic surgeons in the island, people that they were eager to listen to what was new, what was coming, what we should move. And I think the breast cancer community of the island, they are all very nice people, and we all try to set up the standards. And it's amazing that in our island, the survival rate for breast cancer is very high. It's among the highest in Europe, which is great because it means that we've done something correctly. I have to say that in this journey, the patients help the most. And it wasn't the politicians or the Ministry of Health that they should have been with us. It was not them. It was the patient advocates that they stood there, they listened to what we had to say. So when we said, okay, I remember that the surgeons used to do axillary dissection, so removal of all of the axillary nodes. And in England, when I came, we've done the sentinel lymph node. And I met with them a few of the surgeons that did lots of breast cancer practice, and we said, okay, let's change it. We can do it. We had fantastic radiologists. The whole team was very good and very eager to learn. And, if the patients do not trust you, you cannot do it. And the patients, and like Europa Donna, and at that stage was Stella Kyriakidis, Evi Papadopoulos, brilliant women with vision on what Europe was doing with breast cancer. And they stood there, and we changed lots of the things for breast cancer patients in Cyprus. And it's when I go back and I see where we started and how we continue the journey, I am proud. I'm proud because the Oncology Center was there, the team, hardworking people, all our nurses, the reception, our radiologists, our radiographers. It's like a family. And when you walk in the center as a patient, you realize that this center cares for the patients. Are they all happy? No, of course not. You can never be all happy. But I think overall, even if sometimes people complain, even sometimes if we let patients down, it wasn't on a bad purpose. The whole center acts as a family, and they have helped to raise the standards of oncology in the whole island.
And I think that human-to-human relationship between patient and doctor is really important.
Absolutely.
Especially on this journey of their, cancer. They're going to be with you for, a period of time, and they have to trust you with their life. What have been the biggest challenges within your profession, especially during those early years? Trying to build the trust of patients, trying to prove yourself as a young professional, a young medical professional.
Yeah. At that stage, I never thought it was a struggle. But now, yes, going back, it was, sometimes colleagues might felt that, why she's telling us that, because I was like, okay, that's the protocols and we need to stick on the protocols. But overall, I think the colleagues were extremely helpful in helping us to promote the innovation, the new drugs. It was always a struggle with the, I dare to say, but I'm sure it's everywhere. I don't want to sound bad, but sometimes the struggle was with the drugs. I mean, I remember when we had to introduce a new drug, and we had the fight with the pharmaceutical industry, the pharmaceutical people of the Ministry of Health, because it was very expensive, and you have to, and it's fair, it's their job to protect the budget, but it was our job, knowing the data, to bring the new drugs. And now what I say might sound okay, she's not, because today it's different. Today is like globalization. You ask Chat knows, Europe is near, but at that stage we were not a European nation. It wasn't the interaction we have today with many cancer hospitals everywhere in the world with so much today, because this is how work is done in the planet. But at that stage, you were living in an isolated island with no medical school, with no academia behind you, with no one. I mean, it's like at the oncology center, we were like 2 doctors on the medical oncology and another 2 on the radiation oncology, treating the majority of women of the island. And it was up to us to bring the innovation. So for me, it was always a challenge. If I'm going to the Royal Marsden or to Charing Cross, will patients have the same treatment if they're here in my island? And this is what we've tried to do at these first years, to make sure that every single patient got the best treatment and it was the same treatment as if they were in the best hospital in the world. Finally, the government always supported us because we had the patient advocates. And it was amazing to see that throughout all these years, as an island, we get first new and innovative drugs compared to many European countries. And this is our patients. This is the strength of our patients, because they were always very supportive. And they knew that our fight was for them and they supported us.
What are the statistics of, breast cancer patients here in Cyprus?
Okay.
Compared to other countries?
We seem to have slightly more cases compared to some of the European countries, but this is because we look for breast cancer. So women in the island, they are very aware and they do their screenings. Although the national screening, so the free invitation, they get less patients for many reasons. Women on their own, they will do what we call private screening. So they will go yearly to have their mammography. So we know that in Europe, 1 in 8 women throughout their life will be diagnosed with breast cancer, and we all have a risk of around 12% throughout our lifetime to develop breast cancer. So breast cancer is the commonest disease in both sexes in Cyprus. We have something like 700 women every year with this diagnosis. We are happy that in the island, women come with early stage disease, so we don't see advanced cases. Advanced cases are less than 5%, so the majority of our patients will come with stage 1 and stage 2, and they have a highly curable disease. We are lucky that today we have many what we call survivors, so women that they reach year 5 or year 10 and they are alive and well, and we have thousands of them. And we are trying to do a special clinic for these patients because they have other challenges, but it's very encouraging. And this is what I say to every single woman that walks in my clinic with a new diagnosis, and it's frightening. I think the frightening about breast cancer is that you don't expect it. It's not like, you're a smoker and you cough and you think, okay, I might have lung cancer. You just go and have a mammography and suddenly someone tells you have breast cancer. And it's shocking. I'm sure, it would have been terrifying for me if I was a patient. It is terrifying for our patients. But what I keep telling them is that if they look outside the waiting room, they will see many women that have been cured with breast cancer, and this disease is highly curable. And this is what science have helped women, that we see an improvement in the overall survival, even for our patients that they have more advanced disease. So women that come and they have what we call metastatic disease, again, the life of these patients have changed because we have better drugs. And these women also can live many years.
I'm just thinking about the women and, some of the, it's shocking to get the diagnosis. And I guess the first thought for most of them is like, I don't want to die. I don't want to. But are there other challenges that they are having to face? Not just kind of like the first initial fear of, death, but, there must be other struggles that they are kind of going to go through, especially those who, after who you were saying, what you called the survivors, 5-10 years down the line. What are their kind of challenges?
It's a journey. Breast cancer is a journey with many challenges. So the initial diagnosis for the patients is frightening. And then you might need chemotherapy. And it is frightening because you have hair loss. You might feel a bit bad. Although again, compared to what we used to do 35 years ago, 40 years ago, it's nothing. It's much, much easier today. But they still have this hair loss and it's devastating. It's the fear if you have kids at home, how they will see you on this journey. And then, if women need to take medication for anti-hormonal medication, sometimes they have the hot flashes, weight gain, vaginal dryness, their relationships with their partners. So it's all these issues, it's small issues. But again, for me, to be able today to challenge all these things where 30 years ago when I first started breast cancer, my concern and my fear was for them to be alive. And today I know they will be alive. So I'm trying to pick up the small things for their life. So they are absolutely good. They have good quality of life. This is a big victory against breast cancer. And then you have the older women that, they might be, because every age has different challenges. So we have older women that they might have arthralgias and, they want to play with their grandchildren and they have pain because I give them this medicine. So everyone has little challenges. And our survivors, sometimes they have side effects from old treatments like neuropathy, some psychological distress, and you need to be there and the team needs to be large. And some of these programs, they are not profitable. And the government needs to come and see we have many survivors. What do they really need? And here you need a plan ahead from your country because we live in a country that now oncological facilities are very good. We have many survivors and the government needs to sit down with us and see the challenges of these people.
I read a statistic that overall more male partners leave their female partners if their female partners get a diagnosis rather than the other way around. A lot of people say it's because women are more usually are more the caretaker in like the partnership. Has this been your experience?
Because I mainly see women. I don't know about the statistics, but yeah, you might be correct because women, they see themselves more like carers. On the other hand, there are, in this journey, you can either build up a very strong relationship with your partner or this journey might destroy a bad relationship. Very rarely you will see people that they have strong relationships to be destroyed by cancer. Normally it's the people that they were, not in good terms and suddenly the strain of cancer might take them apart. It is, and again, in the past, we never cared about the partners. And now we need to do it because it's very frightening. Sometimes if you are the husband or any partner and your wife goes through, your girlfriend goes through, or your mother goes through this, it's more frightening for you. Because sometimes you don't know how to handle the emotions, your fear of loss. So it is, cancer needs very strong psychosocial support. Because both, either in a couple, both people need support.
How does cancer affect the family?
Again, the majority of people will struggle at the beginning. So if you have children, they will have the fear if they see the mother with, the hair loss. It is a strain, like any disease, though. It's not only cancer, because we always say cancer. Any disease can put a strain in the family. But if people, what I tell my patients is, if they continue their life as normal as much normality, especially if they have kids at home. This is a good example for the kids that life will go back in normality. And our treatments today are short. We don't have longer treatment. So if they have good support, they will manage. And we live in society that still people care, the neighbors, the friends. It's a very caring society compared to some of the big European cities where people are, living apart. Here, the majority of patients will have a good social support.
I feel like you're a very warm person. I wanted to ask, how do you keep yourself just so positive or just psychologically, healthy when you are dealing with such, difficult periods of other people's lives?
Yeah, it's not easy. It's not easy. I mean, okay, you see me now. Sometimes it's difficult. No, it's very difficult. Death is always very difficult, Annette, and we have death. And it's something that it drains you. It drains you. I mean, you will feel, sometimes we get bonded to the patients. I mean, some of my patients, I do see them more than my family. I mean, imagine some of the patients who have more advanced disease. I might see them once a week, sometimes twice a week if they have problems. And these people, they know me. I know them. They know my children. They know what I have been doing in my life. And it's a loss for us as well. I mean, don't think that doctors can be, I'm here and my patient's there. It's never like that. But you have to be professional. And we have to be professional. And we have to, in Cyprus, I always thought that oncology in Cyprus was by far more difficult to what I used to practice in the UK, because here I know people. So here I will go to the supermarket and suddenly I will see my patient, or I will see her mother or the kids. And it's very difficult to be distant. For me, the way I handled this through this year is to knock my colleague, Eleni. Eleni is my co-worker that we built at the practice together. So because I'm so extrovert, I always go, we always used to sit like 5-6 o'clock in the afternoon in the clinic, and I used to moan, oh my God, this thing happened. And Eleni is very quiet, so she always listens, but I supported her, I think, because she used to tell me the problems. And now we have more people in the team. We have 2-3 fantastic new ladies. So in breast cancer, it's a female practice. And I'm trying to support them because they need to speak. This is a profession that you cannot keep inside you, the stress of the handling of a patient. It's very difficult. And we are better today because all the cases are discussed to the multidisciplinary team. So we have twice a week meetings. So we discuss them. And by discussing them, we also offload our stress. So I might say, I saw this young lady and I'm very stressed because I'm not sure. This is the way, because it's very difficult. I mean, it's very difficult to do it alone. You cannot do this alone. You need the team.
You need the team.
Yes, absolutely.
It's just like you keeping all of that within you is going to just weaken you as a professional, and you're not going to be able to provide the support to the patient. Like, we say how, in order to raise a child, you need a village. In order to help somebody, they also need a village. And I guess this is what you're providing, the village, not the solo
absolutely.
person.
It is. It's a stressful job. I mean, you have lots of challenges. And, you might have angry families. You might have death. You might have toxicity from the treatment. It is. And we're humans. I mean, we cannot, behave like we are distant. We are not distant. And for the mental health of oncologists, you need to speak about your practice. And the good thing about the team meetings is that I think they act as a support network for all of the team to be able to move on.
We talked about success a little while ago. How about failure? How would you define failure? And has there been a moment that you felt was a failure in your life?
I'm sure there are many moments that you feel like failure, when failure, fear, when, things don't go as good as you expected. So we start treatment and suddenly treatment doesn't work and you have a very angry family. It's very difficult. It is a job that you deal with people. And what people should understand is that indeed we are trying our best, and science is here to help, but it's not 100% success, unfortunately. I remember, and I always say that to my patient, because that was one of the most devastating times of my life, I had this lovely young lady who came with a big breast cancer, and she needed to take the treatment, and we give these new drugs, and this woman actually had an underlying disorder, something a bit strange. So suddenly she gets this very unusual side effect. And when we say it's a risk of 1 in 3,000, yeah, someone will have it. When we say it's 1 in 3,000, yes, 2,099 people will not get it, but one will get it. So I think it was a Saturday, and I'm sitting in my house, and I received this call from a young girl who was probably 16 or 17, screaming on the phone, telling me, "Oh, Dr. Marcou, my mom is on the floor and she's not responding. And I said, "Oh my God." I said, "Okay, get an ambulance now." And she was very lucky because it was a doctor there that resuscitated this lady. And this young girl, who I adore her and she adores me, went to the ITU and she was comatose for 5 days because she had a very unusual reaction. Okay, I'm not saying that for people to panic, but what I say is that I didn't sleep for many days because it wasn't my fault. You have to give patients drugs. You have to. It's what I tell my newer colleagues. You cannot not treat patients because you're frightened of the side effects, because by doing that, you put the life of patients at risk. And anyway, she's absolutely fine now, and she keeps coming and sees me once a year. And we always joke about this event, but it's a very stressful job. It's a very stressful job.
I can imagine. I want to talk about the health sector, our current health sector in Cyprus. What is the state of the health sector in Cyprus today?
Okay, overall Cyprus health care is at high standards, and I think we are lucky. We live in a country where we have access to medicines, especially in cancer. We do have, and we are very lucky. The problem of the health sector of Cyprus now is the lack of audit. So we don't really know what we have been doing. So for us at the Oncology Center, we always do small audits, and we know our success, our losses. Overall, though, the health system, the practice of medicine in the island is not scored. So we don't know, how many deaths we have from cardiac disease, and if these deaths could have been prevented. We don't know if, let's say, a surgeon that does cardiac surgery, what is the success, what is not the success, can we score that? Because if you want to improve in the next 10, 20 years, you need to have your statistics right. So this is the auditing of the medical profession. We haven't been doing that, and we need to do it. The new system, we need to, I think, utilize more our primary care physicians. Some of them are fantastic, but they need to start seeing more patients, not more patients, to see patients, because we have been doing medicine over the phone. And it doesn't mean that they all do it, no, but the system allows doctors to do medicine over the phone. So if you call your doctor and say, "I have a cough," he might say, "Okay, go, I will put your referral to see a lung physician." No, he needs to listen to you. You need to go to the surgery. We need to go to the practices to measure our blood pressure once a year. So doctors need to see patients if we want to improve. So our primary care needs to improve, and we need to do more preventive medicine. So if the primary care physicians see the patients as they should once a year, monitoring about obesity, they check you if you've done your smear test, if you've done your mammography, have you seen blood in your stools? This is the things you need to improve the health of the nation. So to do prevention, we don't want to treat patients. We want to prevent them from getting the disease.
What about educating patients about
Very
healthy
important
lifestyle? Do you
Very
think
important.
we are on track there, or
I think there are lots of initiatives, but I think we are not that health educated as Cypriots. So we believe in many strange things, but we need to start. So we need to know that, yes, once a year after the age of 50, you need to check your blood pressure. You need to. You need to make sure that you check your stools after the age of 50 for prevention for colon cancer. If you're a woman, have you done your mammography? So we need to get doctors, primary care physicians, and patients together so we act sensibly in a way to prevent the disease.
What are the values that you live by?
Okay, difficult values in this island nowadays, but I think, and I strongly believe that in life you should be optimistic.
Yeah.
Because positive energy will come back to you, and I believe that. You should be ethical. You should be. And we live in a country where people don't realize what is conflict of interest, what is corruption. And I'm very sad because I'm a Cypriot, and I know, Cypriots are such a nice, they're very nice people. They're very giving. They're very lively. But this corruption thing is dreadful. So I think you need to be ethical because at the end of the day, and this is what I've learned from oncology, even if you are very wealthy and you've managed to get lots of money out of unethical ways, when you are not well, money will not help you, and you need to be well mentally and physically. And to be well mentally and physically, you need to be a right person, and you need to be correct in what you do. So my values, as much as I can, is to be giving and ethical, and to work hard. And I live in an island where I love this island, and I want to give back to the people of the island with as much as I can. I cannot change many things, but as many things I can change, I would want to do it.
And my last question for you, what is the future you're building towards?
I think the future of my island, that's my future now. I'm at an age where I've done my duty in medicine. I want to improve. I still love what I do, and I want to improve the services of the oncology patients in the island. And I think on a small island, we can do even better. We can have better statistics. We can make sure that every single patient gets the right treatment. I want to stop the fragmentation of the oncological services, because this is against the Cypriot patients. You know, you cannot have doctors treating 2-3 patients. You cannot. It's impossible. We need to stick on the European guidelines, and we need to concentrate knowledge for people to have best care. So for me, whatever time I have in oncology, I want to improve this, the access of patients to preventive medicine, as you said. So educate people about health, about diet, about environment, about screening tests, and improve the access for everyone in that lives in the island.
Thank you.
Thank you so much.
Thank you.